The joy of childbirth is considered an amazing feeling. The ability to create life is viewed as a blessing. However, not everything about childhood is merely blissful. You see, new mothers can be at risk for perinatal and postpartum depression, which occurs during pregnancy and the weeks after childbirth. Symptoms of this depression can include severe mood swings, insomnia, difficulty bonding with the child, or even repeated crying. It can even reach to a limit where mothers may harm or kill their children.
Transcranial magnetic stimulation, also known as TMS, is a non-invasive treatment approved by the FDA for major depressive disorder and obsessive compulsive disorder. Its high success rate and limited side effects have researchers wondering if it could be a potential treatment for postpartum and perinatal depression.
Yeah, so I would describe TMS as a electromagnetic stimulation modality that targets dysfunctional brain circuitry, and is currently FDA approved for major depressive disorder with and without anxiety, obsessive compulsive disorder, smoking cessation, and is really being used by behavioral health clinicians to most of the time target treatment-resistant depression.
By using magnetic fields to simulate specific brain neurons, particularly in the prefrontal cortex, TMS aims to alleviate depressive symptoms. Unlike invasive procedures that require surgery or anesthesia, TMS is administered externally, making it a safer option. There are two main types of TMS: repetitive TMS and deep TMS. The former delivers magnetic pulses at specific intervals, while the latter reaches deeper brain regions. TMS offers minimal side effects compared to psychotropic medication and electroconvulsive therapy, also known as ECT, making it a promising alternative for patients. A groundbreaking advancement in TMS treatment is the SAINT protocol, developed by Stanford, which compresses the usual 4 to 6 week regimen into just 5 days with 10 sessions per day, though it may result in intense fatigue. Research on pregnant and postpartum women in psychiatry is often limited due to concerns about impacts on the fetus and breast milk. While mothers may avoid medications like SSRIs due to fear of harm, and treatments like ECT and DBS are typically avoided for their seizure-inducing effects, TMS offers a promising alternative. Studies on peripartum mothers show that TMS effectively treats depression with minimal impact on the fetus or breast milk. Overall, TMS is non-invasive, doesn't cause seizures, and avoids the need for anesthesia, making it a safer option for maternal mental health care.
That is an area where we really don't have answers. There have been small studies that have looked at the safety and efficacy of TMS during pregnancy and in the postpartum period, and it appears as though TMS is safe, although there have been small studies looking at TMS in pregnant women, and I can't remember what exactly the studies showed, but there might be some rare complications seen in patients who are depressed and pregnant.
Despite TMS's benefits, its FDA approval for peripartum patients is debated, with some experts urging more research since current studies are small scale. While TMS is considered safe and effective, further research is needed to confirm its efficacy for all patients, particularly in larger, more comprehensive trials. The treatment shows promise, but requires more evidence to ensure it works universally.